Directors are now finding themselves on the front lines of this pandemic. But as News 3 reporter Antoinette Delbel tells us, federal regulations meant to protect the patient are standing in the way of protecting some funeral directors.
The job is atypical of the frontline worker.
Caskets are typically here.
But nonetheless, funeral director Tim Smith is putting himself on the line to collect remains from hospitals.
I've never walked in the door of the hospital and had a guy hand me a mask first and say, don't come in here without wearing this.
Smith runs R. Hayden Smith Funeral Home in Hampton. He says when he walks into hospitals to transport a body, he doesn't know if he's dealing with a confirmed positive or negative COVID case.
They will use like a tag coding system, yellow tag, red tag, whatever. But no, they don't ever actually give you that information.
According to Smith, HIPAA laws prevent hospital workers from releasing patient information. It's a way to protect patients, but he says it doesn't necessarily protect funeral home personnel.
The concern with the COVID, is this question about how long it's active on a hard surface.
Smith says he knows he's transported at least 5 people who have contracted the virus, only finding out through family members who've called to warn him. With the uncertainty surrounding the highly contagious COVID-19, Smith fears he could pass it on to his loved ones.
Any contact you have, you're taking home to your family.
A spokesperson for Sentara Healthcare says they have a policy in place letting funeral directors know if a patient has a transmittable disease like COVID, but Smith says that's not the case for other area hospitals. We've reached out to the Virginia Health Department to clarify the HIPAA laws and are waiting to hear back. In Norfolk, Antoinette Delbel, News 3.